Welcome to another episode of Listen, Learn, and Love, hosted by Richard Osler. My guest on today's podcast is my friend Jeff Case. We should call Jeff Case Dr. Case because of his clinical expertise and training. We're going to talk about suicide today, and Jeff has clinical expertise in this area. I attended a seminar he gave, and it helped me to understand better why people may be thinking about suicide so that I could help them. So this will be a podcast that will be helpful for any of you that perhaps are suicidal and those of you that are trying to help others that are in this space. So welcome to the podcast, Jeff.
Thank you. I'm really happy to be here.
Will you give us just a bio of you, introduce yourself to our listeners, especially your academic training and then what you're doing now professionally?
Yeah, thank you. I was born and raised in the Air Force, so I don't have a hometown. So I'm kind of from all over. My father's last duty station was in Arizona. So my family resides in Tucson. They've been there since 1993, but by then I was already on my mission. So I attended Brigham Young University.
Where did you serve on your mission?
I served my mission in the Fort Lauderdale, Florida mission. I was Spanish speaking, so I was really in central Miami the bulk of that time. And that was sort of actually an interesting place where I started developing thoughts of going into psychology at that time.
Very cool.
I did initially was studying music education at BYU until the bug of psychology kind of burrowed itself into me a bit more. Actually, truthfully, it was my sophomore year studying music education. They put me in a classroom with 45 12-year-olds that all had things that made noise. And I thought that this might not be a good life plan for me. So I found my way over to the psychology department and ended up getting a PhD in clinical psychology from BYU.
So go through you got an undergraduate in what?
My undergraduate, I finished the music degree.
So you finished that, but you knew that wasn't going to be long-term.
Correct. I think for every musician, there comes a point where you have to decide or think out loud, is this the place where I make money or no? And I play tuba, so the answer was no.
And the next piece of your education was to go ahead and get the PhD, or was there something between that?
No, I did earn a secondary bachelor's degree in psychology, and just went right into a PhD program. There was no master's degree.
Okay. Sometimes I'm confused on how that works. How long does a PhD take?
About 5 years. So
that's a big deal.
Yeah. Yes. It took 4 years of coursework and then a year of full-time internship in the field. I took my route to the military and did my internship and residency years with the military, and then spent 8 years on active duty as a psychologist with the military.
And when did you get married in this academic world?
So my wife and I met. So she was also in the music education program. So we met really kind of from the beginning of our education. And we married, I think it was just before the start of our senior year. And I should say our first senior year. So we were married in 1997. I was 23. She was 21.
That's great. And you have how many kids?
We have 3 children. We have a 19-year-old son who is currently serving a mission in Chicago. And we have a 17-year-old daughter who's a junior at Pleasant Grove High School, and a 13-year-old daughter who's in junior high. She's in 7th grade.
That's great. It just helps our listeners. And Jeff's wife, Sarah, is here. They came together. Sarah offered a wonderful prayer as we started this podcast that this would just be helpful for our listeners. So let's talk about this subject, Jeff. Let's say I'm just trying to learn about how to help people that are suicide. So let's kind of just turn it over to you to give our listeners a seminar.
That's great. And I would love to hear any questions you have to help guide the conversation so I don't get stuck on the minutiae too much.
Yeah.
So suicide's a tricky thing. First of all, it's a highly emotional topic. It brings up a lot of things. It's hard to find somebody anymore who has not been directly affected by suicide, whether it would be family or friends or even themselves who have experienced suicide. So I think it's important to kind of recognize that this topic is very sensitive, and I hope that I can speak about it in a way that is respectful of that.
And just as a note, when this seminar I attended of yours, Jeff, I was struck with this balance you have of great clinical experience working with people that have been suicidal or thinking about suicide, and your academic experience. And I love the way you have both of those worlds coming together to really help on this subject. So that really helped me listening to you.
Oh, thank you. So as a clinician, obviously the topic of suicide, being a clinical psychologist, does come up quite a bit. In fact, about every session, I have to ask the question to every client every week. They get tired of it. Are you having thoughts of suicide? Are you having thoughts of killing yourself? Which is an important question.
Why?
It's important to kind of ask the question because if people can start talking about it, then it alleviates some of the stress and brings it from a dark, hidden place. For a lot of people, this is kind of a very intimate secret they keep for themselves, and they don't want to bring it out to light. And if they just keep it internal, it tends to grow and fester and eventually starts moving down the road from just the thoughts of dying to starting to do plans and preparations. So it's important to always ask the question to bring it out. One of the myths about suicide is that if you talk about it, it will give people the idea.
Interesting.
This is a myth because most people who are at risk for suicide are thinking about it. In fact, a lot of people just in the course of their lives think about it on a pretty, not as a regular thing, but as just a course of being human. I'll give kind of an example in my life. I will say I do not have a diagnosable mental illness. I've been grateful to have been spared of those difficulties. I will say that I have been overwhelmed in my life at times, specifically in grad school. I recall just being overwhelmed with the thoughts of writing a dissertation, of completing my comprehensive exams and the coursework, and how could I possibly get through that? And I recall being on the side of the road waiting to get picked up, and a UTA bus coming down the road. And I never thought to jump in front of it, but the thought that I had was, if the bus jumps the curb, I don't think I'd get out of the way.
It's honest.
So it's what we would call in the profession like a morbid rumination, a thought about dying, and rumination meaning it's a recurring thought of, I'd be better off if I weren't alive. So this is sort of the entry point into suicidal thinking, though. Most people have that kind of a thought. I'd be better off maybe if I didn't wake up tomorrow morning, that might be okay.
And what did you call that again, Jeff?
Morbid rumination.
Morbid rumination.
Correct.
I won't spell that for our listeners because I'm a terrible speller. And you said most people have those kind of thoughts at times in their life.
Yeah, that seems to kind of play out in the literature and also just in my discussions with people, that it's common to have that thought. I might, if I don't have to go to work tomorrow, that'd be all right.
That's probably good just to realize that if you feel that way, that's I guess a normal thing, or a thing that other humans, the majority of most humans, feel or think at times in their life. And then I guess is what if you do with that?
Right.
Now, circling back to the question you ask your clients, you ask them about suicide. It sounds like, is that an appropriate question for a priesthood leader or a parent to ask?
I think it's an important question, absolutely. I think the fear we have in asking the question is, what would I do with the information? What if the person says yes? And that's the main fear. I think that, and with that fear, we don't ask the question because we don't want to hear the answer. And the fear is, well, if they say yes, I'll have to deal with that. And the response that I try to give people when we give trainings, the buddy aid, the self-aid, or just the training people kind of on a friend level, the idea is that you have to ask the question to find out, but it's not your responsibility to treat the illness. If you ask your friend, hey, do you think your arm broke? And they said yes, you would not be responsible to set and cast the arm. You would be responsible for getting them to a doctor who could do that. So when I train people, I say, ask the question, but don't feel like you have to fix the problems that are leading to their suicidal thinking. Your job is to get them to a doctor who can treat the illness.
That's very helpful. If I asked a question of someone and they said, yeah, I'm suicidal, what would be the next sort of questions I would ask? Would I ask more questions or would I make statements?
I would always ask more questions. So what we do a lot of times that turns people off from wanting to open up and disclose personal stuff is that people don't want to get lectured at. They want to be heard and understood. So it always comes with more questions. Help me see through your eyes what you're seeing. Help me understand the world through your view.
Wow, what a great follow-up question. That is awesome.
Thank you. And that's the mistake. We want to tell people, no, you have so much to live for. Look at you. Just stand in the mirror, stare at yourself, see how beautiful you are. That's not how a depressed person sees themselves. And everything that we say along those lines is just going to be another cut. All these little paper cuts that we give people trying to bolster them and cheer them up, instead of trying to cheer them up, asking them why they're sad. What is it that drives that? And try to understand just where they're kind of coming from. I think priesthood leaders in particular, or church leaders, I should say, because this includes the Relief Society. Although I would guess Relief Society presidents are probably better at listening and just asking questions.
I think we both agree.
That might be a stereotype, but
I think we'll go with it though.
But just to ask more questions, preach less. So talk less, listen more, and understand the worldview of that person. And then in the asking of questions, if it feels like this person really has some deep-seated things, get them to a doctor, get them somewhere where they can be taken care of.
That's very helpful. And certainly in my own, as when I served in my way, I say, Simon, I never asked that question the first year and a half. And then but I was dealing with people who had really complicated issues. And I think for some of the reasons you mentioned, I never asked the question. And then I started to ask the question. And I realized that a lot of people, needed someone safe to ask that question. And I learned not to just say, you're going to hurt yourself. I learned to say, are you suicidal?
Right.
Because it sort of gave them permission to go all the way to there with me, and that I was safe talking about this subject.
Yeah. And asking it, I think that's an important point to emphasize. Are you going to hurt yourself? Most people who are suicidal don't want to hurt themselves. They want to kill themselves. So that's an easy deflection to say, no, I don't want to hurt myself. I want my pain to be over. That's what's driving this. So it's not the right question to ask. So don't use euphemisms. Don't beat around the bush. Just say what you mean.
That's good. Keep sharing with us stuff that's helpful.
So one of the things that I think is tricky with suicidal is, for example, the idea that, first of all, this is not an on or off switch. Are you suicidal? Yes or no. Think of it more as a dimmer switch. And there are levels of intensity that where a person is really kind of close to the point of committing to ending their life. And then there are points where it's very dim and it just starts to kind of come out a little bit. So hopefully today we can talk about the factors and that progression from just being very dim to being very bright, very strong, very compelling. Because that's the conceptualization that the current research is really emphasizing, to understand what is it that turns that light switch brighter, or that dimmer switch brighter.
Yeah.
And then how we can bring it down. The other problem with suicidality is that even though it happens way more often than it should, and especially the rates in Utah are frightening right now, especially among the youth. It's really unprecedented and not seen in most places. And I think it deserves a great deal of attention. So that's, I think, why it's great to have these episodes and these podcasts. I will say that even though the rates are high, it doesn't happen that often. So what I mean by that is, I will say, like, the vast majority of people who die by suicide, about 95% of them suffer from some sort of psychological condition, some kind of mental disorder. But the vast majority of people with mental disorders don't commit suicide. In fact, they may not even attempt suicide.
Interesting.
So it's a correlation that only goes one direction. So how do you find them? Another example of the same kind of problem is that about a third of people who died by suicide have a medical illness at the time of their death.
Interesting.
But the vast majority of people who have any kind of physical illness, or they don't think about suicide, and they don't commit suicide. So how do you find it's not even a needle in a haystack. It's a needle amongst other similar needles. and how to predict this, how to kind of find this out. And that's what gives us a lot of stress in my particular profession. That's the part that gives us a lot of stress. And that's why we ask the question at every session to every person, because we have to kind of be on guard, not being able to really predict very well who's going down that road. One of the phenomena that can happen clinically, a person can be very depressed and having a lot of suicidal thoughts. And then all of a sudden they perk up. Their energy goes up. They seem like they're doing a lot better. And so the clinician may let their guard down. Oh, he or she is recovering really well, so I don't have to worry about this anymore. And then the person dies. And what has happened is the person has had conflict with living or dying. And that conflict is one of the feeders for the depression or the anxiety. And when that conflict exists, a lot of times action is not taken. The person that looks like they may all of a sudden be in recovery may have just resolved that conflict and have decided to die.
Wow. If I'm a parent, or if I care about someone that I think is suicidal and I see that, what would I do?
So the first part of that, I think, really is, again, to ask the questions.
Ask the questions.
And sit with the person, talk with the person, understand their point of view, show compassion, show love, but don't tell them love, right? I love you. I want you, it's important to kind of hear that, but actually demonstrating that, showing physical affection if the person responds to that, doing things together. But really the most critical piece, get the person evaluated, have them see a mental health professional. Like I said, it could be on a very low, dim setting that the person is at. There may not be anywhere close to formulating suicidal thoughts, and certainly not plans yet, but don't take that risk. If it were your child that may or may not be having a heart attack, you don't take the risk and assume it's not a heart attack first.
Yeah.
You get the evaluation done in case it is.
How long I can't remember the word you describe it, but someone who's in the conflict and so it weighs them down, and then they've made the decision and they feel the weight of that, and so they actually feel happier, appear happier in recovery, I guess. Is there any feeling from your expertise of how long that period is between decision and completing suicide?
Typically not long, maybe a day or two. When they start doing the plans and preparation. Let me talk you through the progression.
Good.
And that'll kind of give insight into what we're talking about. I want to say, first of all, there is a progression because it's a difficult thing to end one's life. You're going to commit violence on yourself, and we're wired to not do that. Have you ever tried to bite your hand and make yourself like bleed or really hurt yourself? It's like there's a thing in your brain that stops you from doing that, right? And so part of what we'll talk about today is sort of what we call the increased capacity to hurt yourself or commit violence. So there is usually a progression. It's very, very rare when we do psychological autopsies on those who have suicided for them to go from 0 to 60 very quickly. It's quite rare. It does happen, but it's fairly rare. Usually there is kind of a progression that we can watch. So it kind of starts, again, with some form of suffering, right? Either the mental illness or the physical illness, chronic pain. I think we need to make sure that we're addressing as a society, because this is a predictor for suicidality. It's so demoralizing and distressing and isolating. So there's a point where someone is experiencing some kind of distress or discomfort, pain, or and the thought, I'd rather be dead than keep living like this. So enter the morbid rumination phase. From that, we start thinking not just about I would be better off dead, or maybe it'd be nice if I weren't alive, to the formation of the suicidal thoughts, which is the thought of I would be the one to take my own life. That's a suicidal thought. Not that I'm just better off dead, but maybe I need to be the one that would enact that behavior to have it happen. Going from the thoughts, we start talking about plans and preparation. So then how would I do it? What are the means that I would use? Looking around you, people sort of pick means that they think will be either effective or that they can tolerate. Because again, they don't want more pain. They just want the pain to be over. So they want to find a way to do this and not increase their pain. So they start doing the plans and preparations. Some people get caught up in that place. and I've had a few cases where if they could figure out a way to die and make it look like an accident, or so where their parents wouldn't feel guilty, or where if they could do it in a way that wouldn't cause other people pain, they would. So they get caught in the plans and preparation phase. So from there, if they continue to progress, they move into the phase of rehearsal behavior. Like I said, it's a difficult thing to enact violence on yourself. So we find that a lot of people will engage in some form of rehearsal behavior. This might look like small cuts on the arm before the big cut is made, right?
That's a good example.
Or holding a gun, seeing what it feels like. I've had clients tell me they've put the barrel in their mouth when it's not loaded to see if they could do it, and just hold it there until they get used to that sensation. So they're really in the final stages of the rehearsal behavior, or they may be researching, how many of this would it take, and we're really in the very dangerous phase at that point before they actually engage in the suicidal behavior. So even people that are committed to dying, they still have to overcome this wiring in our brain. We have an instinct for life and an instinct for death, or for tempting death, right? So obviously the instinct for life are all the things that we do to take care of ourselves. We eat, we sleep, we form relationships, right? We work to have a comfortable living. But we still like to tempt death a little bit, right? So this is like the entire amusement park industry is based on the idea that tempting death is sort of appealing. If a roller coaster doesn't make you feel like you might die, we call it boring and we don't ride it a second time. So we do have a bit of that instinct, but the self-preservation is quite strong. If I were to be sitting with somebody in my office who was highly suicidal and was committed to dying, and I jumped at them suddenly, they would still raise their arms to block me.
Interesting.
There's still self-preservation. So to overcome that self-preservation, that's the rehearsal behavior. And it kind of brings up an interesting idea within suicidal people. When I will always ask them the question, how much are you committed to dying? And how much are you committed to living?
Great question.
And I often find that both of those can be high at the same time. I'm definitely on that road. I use an 8 scale from 0 to 8. Where are you at? And they might say a 6 or a 7 on dying, but they also might say a 5 or a 6 or a 7 on living as well. And so it's that place of ambivalence that we can really operate. Okay, I want to increase your desire to live and decrease your desire to die simultaneously.
I love the scale question. I love that both can be high. That's very helpful.
Yeah. So given that it's kind of hard to predict, and I would say that for clinicians, it's often hard to predict. Of all the suicidal people that I've sat with, and I've had quite a few, I have had 3 clients suicide either during treatment or just after treatment. And it's surprising to me who does, because it's a behavior that really is hard to predict. And I want to say that because I know that there might be people listening who have had someone die by suicide and they think I should have known. And I want to kind of alleviate that on some level, because clinicians, we're caught off guard too. And we're the ones who are asking the questions, and it still happens. So, hopefully people can kind of lay that aside.
That's very helpful.
Thank you. So I think this kind of brings us to the point where we talk about, so if it's hard to predict, how do we understand suicide and what drives the behavior? And I'll kind of talk about three points in particular. This is called the interpersonal theory of suicide. It's written by a psychologist, Thomas Joyner. If you're interested in reading this, he has publications, books, as well as journal articles that kind of summarize his thoughts on where someone lies that would become highly suicidal.
And that's Thomas Joyner, Joiner.
Yeah, thank you. So we know that we have a lot of warning signs. We know that one of the strongest predictors of suicide has to do with like social isolation. We understand that given the warning signs, especially when someone has acute risk, they may be agitated, high levels of hopelessness, sleep disturbances like nightmares, again, predictors. A lot of suicides happen late at night when people with insomnia are kind of up. We know that substance abuse kind of moves into this as well, because overriding that circuitry of self-preservation deep in the brain, substance abuse can impact that in a way that helps someone overcome those fears. So knowing all these kind of things that are out there, Joyner does a really great job of consolidating them into 3 primary constructs that we're going to talk about, that can help us understand where a suicidal person can be. The first one has to do with that social isolation. So he would call it thwarted belongingness, the idea that I am alone. I have attempted to connect, and yet I am alone. I don't have people in my life that I really connect with, and I've tried. There are some people who are perfectly content, either having very few social interactions, if any at all. But these are individuals that become suicidal, or those that really desire social connection, which I think is the vast majority of humans, but feel like they are alone. They feel disconnected from others, or they feel like there's an absence of reciprocal care, meaning I help others, but there's no one there to help me. So I'll listen to people talk, but when I need help, there's no one there. So there's no reciprocation of helping behaviors, right? So, that could come from like family conflict. We know that can also come from a history of child abuse, when the people that are supposed to care for you don't. It has a very detrimental, isolating care, in a similar way that domestic violence would. Again, your spouse is your partner, the one that's supposed to be there to help you and protect you. But if you're in a domestic violence situation, you don't have that care coming back to you, right? So that is sort of the concept of thwarted belongingness. And there are times where that can be so severe all by itself that it could actually predict suicidal behavior by itself. It's kind of a very dynamic effect that has to do with, again, it's not kind of a stable trait, but dynamic meaning it fluctuates throughout one's life. And it's not even that you have people in your life. So that's sort of like a number of people, like, we would call that sort of a quantitative support network. We're looking at a qualitative support network, or a perceived support. So how do I perceive the people around me? Not just am I married, but is my spouse supportive of me? And are we in a mutually supportive relationship? But chronic feelings of loneliness have other things that kind of go along with it, including things like elevations of negative emotions like anxiety or anger, depression, pessimism. When you're alone, you often start to really fear that negative evaluation. There must be some reason why people are avoiding you, right? And even high levels of shyness can create that. So if that's your personality construct, that you're very shy and social interactions are difficult, that could lead to the isolation as well. And like I said, when this becomes a really chronic thing, a chronic loneliness, this can be a predictor for suicidal thoughts.
I like that term, thwarted belongingness. The word thwarted sort of, in my mind, creates a barrier, or there's something preventing that is something that's supposed to happen. So that's very helpful. Talk about, we haven't talked about LGBTQ. I know you work with LGBTQ military people and you have expertise in this area. If you're an LDS LGBTQ youth, what could this space mean to you? Personalize that space for our listeners.
So imagine you're growing up in a traditional Latter-day Saint ward, where from a very young age they're talking about a family and a family system and a structure with husband and wife. This is a very early teaching, and I've spent a lot of years as the primary chorister and pianist, and so I know all the songs.
Those are great songs.
They're great songs, and they teach,
but they do, yeah,
a certain dynamic of the family. Now imagine every time that's brought up, you feel anxiety because that doesn't fit what you're experiencing, or the thought of choosing an opposite sex partner is a source of anxiety or stress. You all of a sudden start to feel a little bit disconnected. We know that through studies of the LGBTQ youth, that there is this sense of being different than, and when you feel different, it kind of engages that sense of thwarted belongingness. It sort of creates an isolation, a loneliness that's problematic. So a person might feel, for example, that they have friends, there are people around them, but they have the secret they keep to themselves, that if everyone knew the secret, no one would like them anymore. And so they have to hide this part of themselves. But by doing that, creates an isolation that's very internal, but also very, very core, very deep, but may not be recognized because you seem very social on the outside. So then moving into the youth years, when you turn 12, and I think bishops are right for doing this, and I think it's a great pamphlet, but they start reading with the youth, For the Strength of Youth pamphlet. In my ward, our bishop makes sure every youth has a copy of it, and they talk about it. And again, it kind of lays out the guidelines for dating relationships and sexual behavior. And there's not a youth out there who hasn't had the talk on the law of chastity, right? But again, what if you've got this secret that what they're talking about doesn't apply to you? What do you do with that? As the youth start going to dances together and dating amongst themselves, and that just creates a lot of anxiety. How do you date people that you're not attracted to? So this creates that sense of thwarted belongingness. I don't know that I have a place in this church that is promoting a specific type of family and saying homosexual relationships are a violation of the law of chastity, fundamentally, whether you're any kind of behavior, holding hands, or things that a heterosexual couple can do as a dating behavior that would not get them in trouble is not open to a homosexual couple. So again, it creates this, I don't have a place to belong here. And I would say that the LDS Church does a really great job of creating community, right? There's this identity, like even people who have left the church still describe themselves as a Mormon, or even saying, when you even say you're an ex-Mormon, you're still holding on to the label of Mormon. There's a real connectedness. And I think that's a powerful thing, that you're not just a Latter-day Saint on Sundays or on Easter or Christmas, but it really permeates your whole life, your day-to-day activities with seminary. And so by creating that, it's wonderful for those who naturally fit into the expectations. But what if you don't? What if you don't? And there are instances where that isolation can get so deep, and the person thinks, well, I don't have a life outside of the LDS Church. So then the suicidal thoughts may creep in. This doesn't fit me.
It's really helpful. And it's, as I've listened to so many LGBTQ people tell me their story, that really fits with a lot of stories that I've heard too, Jeff. And you've probably heard these quotes as I've gone around trying to teach about this subject, and I'm not clinically trained. I kind of wish I could do a do-over. I might actually have not been in the business college and walked over to psychology college. And
we'd love to have you, Richard.
Maybe there's still time at 57, but
of course.
Fitting in is about assessing a situation and becoming who you need to be in order to be accepted. And belonging, on the other hand, doesn't require us to change who we are. It requires us to be who we are.
That's correct.
And so I've loved that statement just to help visualize that.
Yeah. So I think the LGBTQ youth have a great risk at experiencing thwarted belongingness. And it actually ties into the next concept that Joanna brings up, which is perceived burdensomeness.
And I'm going to read just one more before we go on to perceived burdenness. And this is another one that I came across from Brene Brown, that not belonging or physiological isolation is the most terrifying and destructive feeling a person can experience. It's not the same as being alone. It's a feeling that one is locked out of the possibility of human connection and being powerless to change the situation, which I think fits with thwarted. In the extreme, physiological isolation can lead to a sense of hopelessness and desperation. People will do almost anything to escape the combination of condemned isolation and powerlessness. Any thoughts on that quote?
Yeah, absolutely. This is, again, we have a desire to connect to people. It's biological. It's fundamental. We're not sea turtles. We don't leave our eggs on the beach and say, hey, kids, the ocean's that way. Don't get eaten. We have a responsibility to both connect to our offspring and for the offspring to connect to their caregivers. Because certainly as infants, we are 100% reliant on our caregivers. So as a species, we are best adapted when we form communities and are together. I mean, in our society, they've even extended adolescence now to include this phase of emerging adulthood, because it's not even the 18 years kick you out of the house, you're on your own. We're extending it up to like 25 years.
We are at our home.
It's the trend. It's becoming even longer before our offspring are able to function in a society that's highly complex, where access to means for survival is becoming increasingly more difficult, more complicated. So we have to connect for survival. And when we can't connect, we will do almost anything to connect. And so this is the behavior of people who are desperate to seek acceptance. You're going to find your tribe. You're going to find your people, whatever that looks like. And it could come at the expense of yourself, where you may change who you are. My experience as a young person, I was bullied pretty heavily through elementary school and through junior high. And I found myself, to relate to anyone, the stuff I was doing was ludicrous and crazy and not me at all, just to get attention, just to be noticed, just to become someone's friend. Of course, it was all artificial because it wasn't me. It was a facade. I figured this out in late junior high, early high school, and turned things around. But I recall that in that state of loneliness, despair, I remember one day after school just crying with my mom and just saying, please get me to a different school. Let me try to do this again. Let me try over. And just feeling like I just that despair, that heaviness of that thwarted belongingness. I didn't belong. I didn't connect.
It's honest.
Yeah.
Thank you. Let's go on to the next one.
So this idea again, that it's not only that I can't fit in, but that maybe you're a burden on people. So that people might be better off without you. So again, it's a perception. So it's perceived burdensomeness. Psychologists love to use really big words that could be a lot simpler, but the idea that I am a burden on other people, in simpler terms, we might think that my death is worth more than my life to other people. My death is worth more than my life to other people, right? And this comes from the idea that I'm a burden on my family. I don't contribute to society. A client once really was distressing that he was sapping resources and not effectively able to give back. So he was drawing away more than he was contributing to his environment as a person. And therefore, the world would be better off if he were to die. Yeah. On this level as well, that I'm a burden includes the concept of self-hate, how you view yourself. The idea that that as you kind of think about who you are, you hate what you see. So the concept of like low self-esteem. You may blame yourself for all that's wrong around you, which is kind of a powerful thing when you again have like the eyes of someone who's depressed and things are wrong. It becomes sort of this hatred that's aimed in at oneself. And by doing so, when you kind of hate yourself, then it makes it easier to have yourself pulled out of a situation, and the thoughts of suicide kind of increase.
That's helpful. I remembering working with an early release missionary who did everything he could and came home, but that process, I think, was just so difficult to his emotional health, coming home and the logical feelings he felt of failure and then reconnecting, and he needed appropriately so a lot of resources to help him sort of get through PhD or whatever. And he just kept telling me over and over again how burdensome he was and how hard it was on him to need all this resources when he spent his whole life lifting other people.
Right.
And it was really contributing to his suicidal feelings. And I didn't know what to say to him sometimes, to just give him hope that this would pass and that it's okay to feel this way. And what would you say to someone that's trying to help someone that just feels like I'm just taking everybody down and it would actually be better if I were gone because I'm just a burden to everybody.
Yeah, it's such a hard position to come from because a lot of times they're not wrong.
That's all. Yeah.
They're not wrong. In this moment in time, they are not able to contribute very much, and they are requiring the assistance of others. So sometimes I have to be brutally honest and say, yeah, you're right about that.
It's probably good to be honest.
Yeah.
Not sugarcoat that.
Don't sugarcoat it because people see through the BS. Don't sugarcoat it. Just be honest and say, you know what? Yeah, right now we are resourcing towards you and not and you're not able to contribute really in a maybe a physical way. And then once you validate that person and say, yes, I hear what you're saying, and I can see why you believe that to be true, it makes sense to me. So always find the truth in what somebody is saying first and empathize and validate that.
Always find the truth in what someone is saying first instead of BSing. That's pretty powerful what you just said. I wish I had you training me before I started my YSA assignment, because I don't think I felt comfortable doing that for a while, Jeff. And I think the more I've talked with people, I think that really makes sense to validate the truth in what they're saying, and they'll see through the BS.
Yeah. And then once you've done that, what happens is you can now
authentically connect.
Right. They say, yes, you get it. You see what I'm saying. I'm not able to help. I am a burden at this time. I'm not contributing. And then it's almost relieving to feel validated for what you're experiencing. And then you can have an honest conversation. And then you can say, that is true. And there's not any one way to do it, but maybe a discussion that could go like, you may not be contributing directly, but I feel so good being able to help you. It makes me so happy to get you what you need, to make sure that you're comfortable. I love driving you to and from. You have done so much for our family for so many years that it feels so good to me to be able to do this for you. I'll kind of give an example. I was kind of an independent kid. I always worked growing up to buy things that I wanted. My parents were good at giving me the things that I needed. But if there was extra stuff that I wanted, I would kind of have to work for that. And I prided myself in my independence. I graduated high school in Naples, Italy, where my dad was assigned. And
wow,
I loved the idea. And from there, I went to BYU. And to kind of illustrate my independence, my parents dropped me off on the curb somewhere in Naples where a bus picked me up and took me to Rome, where I navigated the Rome airport by myself. And keep in mind, I was 2 weeks after turning 18, but I loved the idea of like navigating this international airport on my own. I got to New York and my next flight had been canceled and I had to figure out hotel and taxi. And I was on cloud
18.
9. I loved every minute. I felt like Holden Caulfield, Catcher in the Rye, staying in this fancy hotel, right? Taking a nice bath, eating a nice meal. I love the independence of it all. When it came time for me to go on my mission, after having lived fully on my own for a year and no internet, there was no way to connect with my parents that far away from BYU, except over the phone. And my parents didn't even have a phone in their apartment. They had to call me from a payphone down in the lobby. So that independence. And I remember like we were shopping now for my mission. My parents had come back. They were preparing me to go in the MTC there and shopping for me. And I was picking every suit off of a clearance rack I could find. No, don't buy me anything fancy. Just, this is cheap. Let's just buy the cheap one. And fighting with my parents. I was so uncomfortable getting their help. And my mom at one point grabbed me and put me in a dressing room, closed the door and said, your father has been wanting to do this for you for your entire life, to send a son off on his mission, and you're ruining it for him. Let us help you.
That's awesome.
I'll never forget that.
What a great story.
So I think if you can, again, validate the person who feels like they're a burden, but then let them know the blessings that you're receiving in helping them. The other thing that kind of happens with a depressed person is that it feels like it's permanent. When you're in chronic pain, it feels like it's never going to end. And there's a sense of permanence with that pain, which again kind of makes the perceived level of a burden on someone even higher, because it's never going to get any better, right? So helping them find the understanding that this is a temporary thing, right?
What do you do? And I really like that. What do you say to someone who's been in this space for a period of time, years of sort of chronic depression, a feeling they're a burden to other people?
Again, I try to be very realistic with them. It took a lot of years to develop a brain structure, a cognitive self-awareness that is overwhelmingly negative, and it's going to take us a while to unwind it and untangle it. And I will try to find ways to demonstrate that experientially in a session. For example, I might have a session with somebody, and I know that they are interested in like musical theater, and I happen to be well versed in musical theater. So we'll just discuss it, and their light in their eyes kind of lights up, and their animation increases, and we'll just talk about just something fun for a while. And I'm like, okay, so you had a moment of sunshine today, and if you can have a moment of sunshine in this past hour, maybe we can make that 2 hours, and maybe we can start expanding that out. But it's going to take some time.
Yeah.
So there is really no quick fix for these things, and people need to be aware of that. That the expectation is that this might take a little while to unravel, but people do recover.
It's really helpful because I have certainly met with people that feel like they are a burden to their family and a burden to society, and that everybody would be better off without them. And I think I tweeted out after listening to your seminar that that's a lie, and everybody would be, in big caps, people would be heartbroken if you left.
Well, this is one of the great myths of suicide, and the person who is suicidal believes they are doing it to end their pain, but truthfully what happens is their pain gets transferred onto their survivors. Their pain lives on. And I don't want to go into what happens with a person after they die, but their pain from this world does not die with them. It just gets transferred to somebody else, usually close by.
I think that's very insightful. I picked that up a couple years ago, and I think that's very insightful. Mm. Talk about how this would affect LDS LGBTQ people potentially, how they would see being LGBTQ as a burden to their family.
Well, it's sort of the comments, the responses that we hear far too regularly. I've heard from people, they're told by their mothers, "You're ruining our eternal family. Your gayness is ruining the prospects of us being sealed for eternity as a family."
And would they say that to a child that's just out as gay and not acting on it, or could they say that even and if they're in a same-sex partnership?
I've heard it on all levels. I've heard it being told to youth. I don't think I've heard that I've not been told that a child has heard that, but I have heard that from youth, that their parents have put the burden on their celestial glory as a family on that person, and how that person might be ruining that. And of course, that's not doctrinally sound. That is not the doctrine of the Church of Jesus Christ of Latter-day Saints. That's the culture. That's problematic. So in our society, we value families that every kid is married in the temple. The boys are Eagle Scouts. The girls have all proudly wear their medallions, and everyone gets married in the temple. And we have this vast picture over our mantle at home of posterity for generations. And that's what we really value. And when a person comes along that doesn't match that, for whatever reason, and it might not even be LGBTQ, but I think with LGBTQ in particular, it becomes sort of a source of embarrassment for the family that, just keep it to yourself. I've heard this from lots of people. Just don't be out about this. Don't be so proud of it. And it becomes sort of the source of like shame to the family. And it just breaks my heart that how your child is would cause your family shame. The old question, what will the neighbors think? That put everything, all these comments that are said, puts more burden on the child to not be who they are, and adds to shame. Shame is a direct correlate to this perceived burdensomeness. Shame is not a useful emotion. Shame teaches us that we are wrong. I go back to the Adam and Eve story to talk about shame, because after they partook of the fruit, the adversary's comment was, "Quick, hide." Shame tells us to hide, to be embarrassed of our flaws, to be embarrassed of and kind of who we are in general. I was embarrassed that I was short. Why was I embarrassed? That I had no control over that, but I was so embarrassed because I was persecuted for being short. Being short was a burden on me. That doesn't make any sense, but it doesn't matter. Again, Joyner talked about perceived burdensomeness because it's not always logical. But every time we put negative energy onto somebody over a thing that they have no control over, we add to that burden.
That's really helpful, Jeff. And as I've listened to many LDS LGBTQ people that want to be out, and they feel that it would actually help them belong to be out and have people to love them for who they are and accept them for who they are. And it's not about leaving the church. It's just about being authentic to who they are as an LGBTQ person. And sometimes people around them, a priesthood leader or a parent doesn't, encourages them not to do that.
Yeah.
And I think my experience is we need to honor the road every LGBTQ person wants to take on the degree of coming out they want to do. Mm-hmm. Because that's very helpful what you said. If a parent is embarrassed about having a gay or lesbian or trans child, and it does add to the perceived burdenness that you are on the family.
Right.
So that's very helpful. And I think the parents, and it may be that way for parents at first, and so it's kind of a stage of learning for them, but it seems like the parents that are creating really helpful environments are celebrating every one of their kids equally and looking for all their good and celebrating their lives and happy for them and not embarrassed at all.
Yeah, and again, this is kind of demonstrated in small and simple things, right, that are kind of cringeworthy. I was in an elders quorum lesson one day, and the instructor was talking and said that he had discovered that his son was looking at porn. And then he said, "At least I know he's not gay." And the whole elders quorum laughed and laughed and laughed. And I'm like, oh. And I raised my hand and I said, it could be worse. He could be a bigot.
Wow.
Nobody laughed at that. The lesson got very awkward. I probably shouldn't have said that.
It's probably good you said that.
Perhaps. But comments like that, well, at least he's not gay, right? That it's seen as this like a mark that's on the family that's really problematic.
I remember one of my impressions I felt during my YSA assignment is I had stewardship responsibility for closeted LGBTQ youth in our YSA ward, and I felt they were there, and I thought, what could I say to add to their burden? Mm-hmm. And what could I allow to be said, like something like that could add to their burden? And so I think that's part of getting the tone right, is if you're an LGBTQ person, as I've listened, you've spent your life hearing negative things about people like you.
Yeah.
Often in our church, not necessarily just the culture, like you say, and in society, and it just adds to this burden.
Yeah, and I think as disciples of Jesus Christ, that's the commandment, to love and always show love, regardless. The Savior showed love to people for whom he was condemned. And I think he would sit amongst all people, especially those who are in the most pain, and that this population kind of represents that. So again, the small things that are said, I don't think most people that would listen would be the kind of people who would make overtly offensive comments. But again, it's the small things that sort of add to the burden, add to the shame. I want to say, one thing that I hear about is how people decry the pride movement, the gay pride, and it comes from a place of they're not flaunting their sexuality. What they're doing, and I love pride events. If you've never gone, I encourage people to go.
Cool.
You will find, when Salt Lake has it, they have the city blocks blocked off, and you'll find love and acceptance that you won't feel anywhere else. And it's a lovely, lovely place. And the reason why the pride has to be there is because pride is the antidote to shame. Shame says, go hide. No one wants to see this about you. Pride says, look, this is who I am. I'm here, and I'm worthy of love, and I'm worthy of acceptance. And this is how I will be validated in my experience as a human being. And everybody needs that. And straight people don't have to do that. There's no straight pride because they've never been felt to have shame for being straight.
Right. They're in elders' quorum hearing those comments.
Right. And laughing and not thinking that that might be hurtful to somebody who's sitting in the very room. We never know who's sitting in the room. And that's why we have to be careful not to add to that person's burden.
That's very helpful. I remember visiting with a counselor when I was serving in my YSA assignment. She taught me the difference between guilt and shame. Those were synonyms to me, Jeff. They were just the same. And I just realized that guilt is sort of this positive thing that creates change of behavior. It's forward-looking. It's full of hope. It's the prodigal coming back. But shame says, I am bad. It's all about, and I actually thought, I came home from YSA interviews one night, and I said, "Hun, I think to my wife, I think I'm just becoming the great de-shamer." I feel like that's what I'm doing for a lot of these YSAs is just pointing them back to Christ, and no matter what they were working on is sort of de-shame them and try to help them still see themselves as wonderful children of God, worthy of His love.
Yeah, that's a really good point. And I think the more we can put names to things is important. It will decrease that internal burden. So when we listen to talks at church and people will say things like, I had a really rough year, or I've been through stuff, or the Lord certainly tried me. And then they just sort of move on. They don't put the names to things. And when people put names to things, it's deeply impactful. When Elder Holland declared depression and he put a name to the thing that helped him come closer to the Savior, that was fantastic. I was in a stake conference. It's always the Saturday night session, isn't it? Where they finally put names to things. And a woman described her experience with an eating disorder in high school. And she put the name to it. She called it bulimia. I was bulimic. And she described in a beautiful way her coming to terms with her illness and how the Savior understood what she was going through and how she learned to understand the Savior through this. And she put a name to it. And I'll never forget that talk because it was named. And we don't like people to put names to it. Comments that I've heard are like, well, you can't unring a bell, so make sure you want to ring it first, right? Comments on, I've said, hey, what if we had this talk on homosexuality at a stake conference? And I was actually talking with the stake president and kind of discussing, different resources and things. And he was so receptive. And I said, in fact, I kind of have a talk sort of devised in my head that could be really impactful. And the way he backpedaled and did backflips over himself to move away from well, I don't think that I'm like, why can't we put names to things?
Wow.
If we put names to things, it shines light on them. And then the person who is LGBTQ can put the name to it and dispel the myth that I am a burden.
Good.
Because I can put a name to it and then look left and right and realize that my social supports are still intact. So the myth of this all goes away as soon as people find out that I'm gay or I'm trans or lesbian or whatever. When you say the thing that you are and people don't abandon you, your internalized self-hate dissipates and that sense of burden alleviates because the people are still there.
One of the wonderful experiences I've had, Jeff, and I want to make sure we get to your other points, was the stake conference I attended a couple weeks ago in California. And I spoke on Sunday about LGBTQ. The stake president wanted to talk about this, but the best talk was the Saturday night talk from a gay member of the stake.
Oh, wow.
And he was the last speaker before the stake president. He just identified himself as a gay man. And he just gave a beautiful talk about his journey as a gay man. But his talk was awesome, but there were some subtle things that occurred. One subtle thing that occurred is he was sitting on the stand with the stake presidency, and the stake president was right in the middle. And so he wasn't sitting next to the gay man. And he could tell the gay speaker was really nervous. So he got up and changed seats with his counselor and sat by this guy and put his arm around him. And I just thought, that was wonderful. But then after the young man spoke, the stake president was the next speaker. So they're both standing up together, crossing in front of the stake. And the stake president just gave this guy this gigantic bear hug. And it wasn't just a little casual bro hug. It was a bear hug. And I thought the visual of that stake president, giving this gay, LDS man a hug in front of the whole stake, what message that sends to the rest of the stake about who that stake present is, and you're, if no matter what's going on in your life, you're safe to talk to that guy.
Yeah.
And I just thought, what will happen in this stake over the next 5 years? Why the stake present still serves because of that meeting.
Yeah, that's really powerful. I was sitting with a very suicidal client once. This was when I was in the Army, and it took him a long time to tell me he was gay. And a long time meaning it was about a 2-hour session, and I could tell there was this thing that was so painful for him, and he was so ashamed of it. And this was during the years of Don't Ask, Don't Tell, so there were some legal implications with telling an Army officer that you're gay. And when he finally did, we had a great discussion. I think it was really, I can't remember what we discussed, but as we got up to leave, I kind of put my hand on his shoulder, and he turned into me, and the body language was, we're going to hug now. And I don't typically hug patients unless it's not, I don't typically hug patients because you just don't know where the person's at with that. But he was leaning into me, and so I did embrace him, and he embraced me back. And then he held me for a lot longer than normal, right? And it was a really beautiful, tender moment. And the next session he came in and just said, I didn't think anyone would want to touch me when they found out that I was gay, and what it meant to him that I would be willing to touch him in that way.
Yeah, you brought some tears in my eyes when I think of that story and what I saw happen in that stake conference. And the other thing I noticed in that stake conference is I just sat in the congregation as the meeting concluded, and there were 4 or 5 speakers, but the longest line from that stake was to talk to this gay man.
That's fantastic.
And I thought, he belongs to that stake. Back to belonging. There's no, they love him and they know who he is, and they still love him. And that line, it took me 40 or 50 minutes to finally, once the line died down, so I could give him a hug.
That's great.
But I just thought, and I love you sharing your experience with, that fellow that came out to you. So keep going. I think there's a third component you wanted to get to in the Joyner, the Thomas Joyner model.
Well, and exactly right. So I would say that people who experience the thwarted belongingness and perceived burdensomeness, if you are overlapping on those two things, your risk for suicide is elevated. This is where the suicidal thoughts really start cranking up. The next part, though, to get into the phase of practice and preparation has to do with an acquired capability to cause violence on yourself. So it's just how do we acquire a capability to do this thing that we naturally want to reject? There are a couple main factors that kind of contribute to this. One is that there's a lowered fear of death. So we find that there are people who don't fear death, or who learn to overcome the fear of death. And it could be for religious reasons. We see that in children who are suicidal, in fact, they're not really afraid to die because of their faith. They know that there's a heaven and there's a God. Especially with children who have lost a parent who want to go be with that parent. They're not really afraid to die. So that's a problem, right? But there are adults who also lose that fear to die because life is so bad that I would be better off in being dead. There's also what we call the elevated physical pain tolerance. That, again, to cause violence on yourself, you have to be able to tolerate a certain amount of pain or discomfort. And so people can acquire that through the rehearsal behavior, the small cutting, or sort of other acts kind of against oneself. One of the things that we kind of look at for the acquired capability is just that person's actual history of suicidal behavior. One of the biggest predictors for suicidal behavior is past suicidal behavior, right? So they have an acquired capability. Each suicide attempt, in fact, that a person will make typically increases in lethality, the mode of lethality, right? So each time they're getting closer and closer to doing the thing that will actually kill them. We also notice that high levels of impulsivity can load onto that acquired capability. So people who are very impulsive, that can be there as well. We know that being comfortable with weapons loads onto acquired capability. And I don't want to go into a Second Amendment sort of issue here, but people who are very comfortable with weapons are more likely to use weapons.
Interesting.
To kill themselves, and meaning that there's not much we can do. A gunshot wound is typically fatal. And so with other things, we treat a suicide attempt, and a lot of people do survive suicide attempts. In fact, the number that's thrown out quite a bit, women attempt suicide 4 times as often as men, but men complete it 4 times as often as women because of the lethality of the means. So to survive a suicide attempt gives us time to intervene and prevent a future suicide attempt. But if a person is comfortable with weapons, especially combat exposure, actually, so using weapons in a lethal way, not just at a practice range, but using it in a lethal way will disinhibit you to use a weapon on yourself.
Makes sense.
So when all these 3 things are kind of overlapping, this is where we find the most dangerous scenario for someone who might suicide. They're disconnected, they're a burden on others, and they have the capability to commit violence against themselves.
So just in conclusion, and this is very helpful for me, and I think for our listeners to understand better who would be suicidal and what's leading to this, and what can be the triggers in the culture, society, and our family, and then what can I do better? Because I think once you understand, then you're able to address some of these things. But if you've got parents that are listening, and I think you've done a good job through the podcast, what 1 or 2 or 3 things would you say for parents that are worried about kids that may be suicidal?
It has to do with that connectedness. How connected do you feel to your children? Is your attachment strong? Is your attachment loving? Do you show appropriate amounts of warmth and acceptance? We've had decades of parenting books that are focused on the outcome of the child, where you want your child to be. They have largely failed. The new wave of parenting books has to do with recognizing that no matter what you do, your kid's going to kind of end up how they're going to end up. But are they going to end up that way with an adolescence and childhood filled with conflict as the parent tries to make them into something different? Or will they feel loved and accepted? A quick example, my son loves Pokemon. I don't like Pokemon. I don't understand it, I should say. And I always felt like he should give it up at some point. Like he would turn 12 and I would say things like, you're 12 now. It's probably time to leave this in your childhood. Of course he didn't. At 14, well, you're 14 now going into high school. Maybe this is the time that you leave it behind. And of course he didn't. And he found kids at the high school that played Pokemon together on their little DSs through lunch. And all this time I could have understood the world of my child. Instead, I criticized, and I didn't have that connection with him. And of course, now that he's out of the house, I wish I had hours of sitting with him, playing Pokemon with him, and really cool. Connecting. My efforts to change him did not work. And he and I have talked about this. We've reconciled. But if our kids know that we love them and we accept them and that our love really is unconditional, that's the place where a kid will thrive. So me as an existentialist, I believe that people have a natural tendency towards growth, and they get blocked when they feel like they don't have the opportunity to expand their own agency to figure out who they are, right? So do our kids know that we love them and that we will always love them? And that will greatly decrease that sense of thwarted belongingness and acceptance and burdensomeness.
That's very helpful, Jeff. And I'm thinking of a Facebook group I'm in. It's a group of LDS parents of LGBTQ kids, and they invited me to be in there just because I'm in this space. And as I listened, there's I think 1,000 parents in there. But as I listen to the stories of parents that have walked this road, and a lot of moms in particular talk about fasting, going to the temple, and how to help their LGBTQ kid, even if they're stepping away. The number one conclusion that they come to is just love your child.
Yeah, it's so powerful.
And just, let themselves sort of determine their future and let go of that. Like Becky McIntosh says in the church's video, I let go of it and I put it at the Savior's feet, and I just love my kid. And there's some relief in that you're not trying to cause a certain outcome, and your job now is just to love. And moms and dads can say, well, I can do that. That's much more doable than having a specific outcome with a kid.
Right. And I think that really is such a powerful thing, and it's so beautifully said. If we just love and show that love, it's easy. Our job as parents becomes a lot easier when we don't have to be the ones in charge of the outcome of that child.
Yeah.
Our job is to show them love, give them agency. I think it's important to teach expectations. And I think having expectations is important that are appropriate to the developmental age of the child. But if a kid doesn't feel like what's asked of him comes from a place of love, then it's just kind of having a dictator for a parent.
Yeah.
And so they
I
have
like
to
what you
have
said
that.
about having expectations and, and teaching the doctrine of our church and teaching good principles. So it's not like you quit doing that.
Right. And then you trust that your child has learned it, right?
Yeah.
And trust in the goodness of your children. We talk about the rising generation. I think every time we say this, the rising generation is the greatest of all, saved for this time. We have to trust that that's true. And if we trust that that's true and that they have been taught in their youth, then that truth will resonate with that child, even if they take different paths. I tell parents, the only reason the prodigal son came home was because he knew he could. And if our kids don't know that they can come back, they won't.
How did he know he could come home?
I don't know. But
he just knew. I'm just wondering if there are verses there or if he just knew, because he did.
Yeah, there's nothing in the text that would suggest he knew. I mean, I think the way his father was portrayed before he left probably gave him an indication that he could come back. But there had to be something there that told the child, I can come back. And of course, he came back as a servant. Well, maybe I'll just be a servant and work for my father.
Yeah.
But he had to trust that his father would hire him.
Yeah.
Right. Again, this was his last effort to get belongingness in his community, back in his tribe. Right.
Just to be a servant.
Right. But he had to know on some level that it was going to work, or he wouldn't have come back. So at the moment of our children engaging in behaviors, and we reject them and throw them out, which I think is a horrible thing to happen to a child, to be thrown out. That child will have a hard time. They'll have to overcome the trauma of departure before they can come back, and they may not. If a child makes decisions as they grow and they leave the church and they live their own life, if they feel like there was no trauma at their departure, there's nothing to overcome to help them come back. And I think you and I both know lots of people later in life who have come back and who have trusted that it would be okay if they came back, and they knew it would be all right.
Yeah. Any concluding thoughts, Jeff?
Like I said, this is a very sensitive issue, and I think there are unique aspects to suicidality and LGBTQ. I think we're getting more data on how these things are really related, and I think it's important to recognize that there are things that we can do. It takes a lot for a person to land in my office. Most of the time, they're going to confide in a friend or a loved one, a spouse, maybe even a parent. So that's the ground level to get people to the doctor. So don't be afraid to ask the questions. Recognize that that's the level that people typically will start talking about this. But don't be afraid. Let the anxiety go, because it's not your job to fix the kid. It's your job to show them love and compassion and get them to a place where they can get help.
Dr. Jeff Case, Brother Jeff Case, you wear a lot of hats, father and friend. Thank you for joining us. I have learned so much, and I know our listeners, this is very, very helpful. And I hope this kind of content makes it into our church congregations and firesides, because I think, and maybe it is in some wards, but I think this is just wonderful content to help us know how to fully bear and mourn and comfort, and to know the nature of someone's burden so that we can do. So this is just very helpful. It's helped me, and it'll help our listeners. So thank you for taking time out of your day to join us, Jeff, and thank our listeners for joining us on another episode of Listen, Learn, and Love.